Okay, so I think we will get started. Good evening, everyone, and thank you for joining us today. As some of you know, GalaxShe is a platform to bring together women so that we can support each other in our journey, whether it's in career or in our lives. And we have been lucky to have a very supportive squad of sisters, like we call ourselves, uh, helping each other out in terms of sharing our insights and learnings. And this is a monthly event that we do where we try to have a conversation around something that is very, very important for all of us. And this is a topic we thought would be very, very important. Seeing what is happening in the country and the emotions that we are all going through, the roller coaster that we are all going through. And I'm very happy to have Dr. Nahid Dave here. It's going
My
to
pleasure. Yeah.
So I will just take a minute to introduce you, and then we will just start having a conversation. And as we go forward, we will open the floor for Q&A from all of you. So, if you feel like putting a question in the chat, you can do that, or later you can unmute and ask the question. So let me start with Dr. Nahid Dave's brief introduction. She's a consultant psychiatrist. She's practices in Mumbai and is very well known. She has been quoted in a lot of media articles, but what made me reach out to her was I saw one of her interviews and she had this great way of, sharing insights in very simple terms, which, we can apply to our lives. And so briefly about her, she is a gold medalist uh, when she did her diploma in psychiatry medicine. And then she went on to do her MD in psychiatry from USAIM. She's trained in advanced concepts like REBT and cognitive behavior therapy. She's also trained in mindfulness and has in fact written a book called Mindfulness for Transformation. And as I mentioned, she has been quoted in a lot of publications, and we are very happy to have you here today. So welcome, Dr. Nair. Thank you for taking
Thank you.
out time.
Thank you very much, Sonali, for such a lovely introduction. Just one correction, I co-authored the book, not written it. Yeah.
Okay.
Yeah.
So the basic thought behind today's event was to, help us figure out how to cope with the, experience that we are having, because I think as a generation, we've never faced so much at one shot in such a short time frame. And, I would basically ask you some of the questions that we gathered from some of the people who are in the audience as well. So, starting with, I will share my own experience. One of my friends recently lost both her parents within a very short span, and it was really heartbreaking. And my first reaction was to just rush over and be with her, but all this is not possible in this day and age. So, my question is, what is the appropriate way to respond when somebody close to us loses their loved ones, and how can we support them, and how can we be there for a friend through all the various stages of grief that they're going through. Okay, I think you're on mute. If you can unmute, please. Yeah, my question was,
I'm not on.
Okay, so I'll just repeat my question. My question was, when people around us, our friends, our family, when they're losing loved ones, what is an appropriate way in which we can really be there for them and support them as they go through the various stages of grief?
Okay. See, right now it's very different and difficult compared to earlier. So if we have to break it down into simple things, what has changed earlier and now? What are the things that have changed? Earlier, when there was a death, you usually had time to process it. It used to happen at a particular age where you see certain comorbid illnesses or you see the person falling ill. So you're somewhere mentally prepared for it to happen. Or for that matter, if you could have a funeral or have a memorial service, you could still adjust and bring it to your consciousness that such a change or such a drift has happened in my life. Right now what happens is that it's so quick, it's so uncertain, it's so unpredictable that your brain doesn't get time to you just don't get time to wrap your head around it. And most importantly, we all talk about video calls and being in connect with each other through digital media, etc. But through digital media, what you hear is sound and vision, just your sound and vision, and that's how you connect with people. But as a human being, you require touch, you require non-verbal communication, you require reciprocation, you require the presence of people around you, which cannot be replaced by a digital platform. So all of that together becomes extremely difficult for us to adapt to. So daily life in itself is difficult. And on top of that, if there is a crisis situation, becomes even more difficult because all these things are not available. Now, most importantly, instead of understanding what we should do, first let's understand what you shouldn't do if a person or a friend or a relative is going through something like this. Whenever a person cries, our first instinct is to make them stop. It begins since childhood. You see a baby crying, you make them stop. You see a friend crying, it is my moral obligation to make them stop. But it's not so. It's not necessary. When someone I know is going through a crisis situation, I want to show them the positive. Tell them my story. This happened to me, and then I went through something similar, or someone I know went through something similar. Or I try to tell them that, at least it's not that bad. See the other person, they have it worse. None of these things help. You don't have to make them stop crying. You don't have to tell them how good it is for them. You don't have to share your personal experiences. All you need to do in such times is tell them that I am there for you, and that's about it. When you're going through the grieving process, there are different stages, but you don't go from one stage to the next stage, and then it can happen anywhere. You can be guilty, you can be upset, you can be frustrated, you can be crying, you can be angry, you can be all of it at one time, and that's okay. So usually we describe it as initially you go through a period of denial where you can't accept that such a thing has happened. Then you get angry with yourself, with the doctor, with the patient for not being careful and so many things. Then you bargain that, I wish I could have it in another way. Then finally you are upset and you accept it. But everyone doesn't go through these stages. So you may skip a stage, you may go through a stage earlier than before the other people and go up and about it like that. So this happens, and people around you are going to be facing it. The only thing you can do is if they want to cry, let them cry. If they want to feel upset, let them feel upset. If they want to spend a few days in bed, that's absolutely fine. They just have to know you're there for them, and that's all you need to do.
Yeah, so you're basically saying that instead of trying to make it better for them, we just sort of be there, uh,
Allow them.
allow them to go through whatever they're going through and just be around them. So they have,
Yeah,
which also becomes very challenging in these times when
in
we
the
can't
current times.
physically be there.
Yes.
So, okay, so what, just a follow on question on that. How can we be there when we are not there physically?
Okay. So yeah, so this creates a lot of helplessness that I want to be there. I want to be physically there for that person. And although the intention is in place, the action is not possible in the current times. It is a practical problem which creates a lot of helplessness in me. So if I am creating a situation of helplessness within myself, I am not going to be capable of helping another person. So in simple words, when you're traveling by flight, and they tell you that you wear your mask first and then assist your children and your elders and your neighbors. So you have to be in a position to be there for other people. And if you constantly keep reminding yourself that I want to be physically present, which is not possible, you're creating a sense of discomfort and helplessness for yourself and making yourself incapable of being there for them. So you have to just accept that I can't be there. And in whatever resources are available, I am going to make myself available for them.
Okay. Actually, my next question is actually related to that, because for many of us who are not with our loved ones, many of us are out of the country and we are not there, you know. So there is this feeling of helplessness, and there is a feeling of guilt that we are not there, we are not being able to support our, family, our parents. So how can we cope with that sense of helplessness and also the guilt that we are
Okay.
experiencing?
So I have seen helplessness in my practice over the past year and a half, not just in the form that you're asking me, but in various forms. So initially, when the pandemic hit us last year, I would get calls from patients saying that, my building is under lockdown, and when I see an ambulance reeling by, I feel helpless. Like, what if I'm next? Okay, then it went on to someone in my building, then someone I know, to someone in my family, and now finally I'm talking to people who have, most people have lost someone really close to them. So the sense of helplessness is there everywhere. Now, if we try to understand this word in its core sense, helplessness basically means feeling stuck. Stuck means there is a clear discrepancy between what I should be doing and what I am doing. And I'm constantly trying to bridge this gap that I should be doing, I should be there, I should be out there, I should be safer, and I am not. And this awareness creates a lot of helplessness or this sense of frustration within me, which I'm not able to overcome. Now, what we have to understand is most importantly that there it thinking about these things is like rocking a chair. You're rocking a chair and you're hoping to get somewhere. You're just in and about those thoughts over time, which creates a sense of discomfort within you. There are only two things one can do in such a situation. Ask yourself, what is within my control today that I can do? Number one. And secondly, if I have thoughts about what I should have done, I should have taken a flight earlier and been there, or what I will do if something bad happens. If these thoughts, the future thoughts, are helping me prepare and plan better, fine, entertain those thoughts and go ahead and prepare yourself better. But if you're just simply rocking a chair, ask yourself to stop there. Stop. And it's a lot of people say that I understand I'm overthinking. I understand I shouldn't be doing, but I can't stop. So ask people to do one simple thing. All of us are very good at procrastinating. We're brilliant at procrastinating daily chores and activities and things we're supposed to do. So you start procrastinating worry. You set up a time. Every day, 10 p.m., I'm going to worry. 10 to 10:30 is my worry time. And whenever you're worried about something which is not leading to anything productive, you tell yourself, "No, not now, 10 o'clock. I'm going to worry at 10 o'clock." And you learn to procrastinate it because worry comes as an impulse. If you don't feed it then and there, you'll be able to go past it. At 10 p.m., most probably you will be like, no, what's the point? Why do I think about it? So you learn to procrastinate worry over time. And simple, ask yourself, what is it that I can do today which is within my control, and do what is required in that sense. Because if we don't take care of our helplessness, it is like a graveyard for guilt. And guilt leads to complicated griefs and the whole cycle after that. So we'll get into it gradually, but yeah, if you have to deal with your helplessness then.
Yeah. So what I'm hearing from you is basically the worrying is not going to help anybody, neither ourselves or the person we are worrying
Yeah,
about. So
yeah,
if we can tell our mind to not focus on worrying right now and push it aside, and
true.
hopefully that will work. Not lead to sleepless
Yeah,
nights. Yeah. Okay.
hopefully.
Hopefully. So there is a lot of talk recently around this whole concept of languishing,
Yeah.
You know,
Yeah, yeah.
can you explain what that is, and how
Okay.
do we cope with that?
So languishing is basically a sense of, aimlessness, purposelessness that a lot of people are facing. So it doesn't fall into a disorder or a psychiatric diagnosis, but it's something like I know what I'm supposed to do, but I can't get myself to start. And if I do, I lose interest very fast. So that what's the point kind of thoughts start creeping in. Like, I don't know where I'm working for a life which may not exist. So what's the point? So that kind of thought process. Now, if you look at it, there are three important concepts that we have to understand why people are facing languishing. The first one is we all are vulnerable. This thought is very scary that it can happen to anyone. It's not something I read in the news, an accident or a famine or a cyclone which is happening somewhere. This is something that we going to get groceries and I could have it and my family could be affected. So all of us are vulnerable, number one. Secondly, whenever I have a problem, we've always had problems even before COVID, but we had a sense of control or we had a sense of, I know what to do about it. So if I get stuck in traffic, if I goof up my food, if I don't pass an exam, I know what to do. Over here, there is no time limit, there is no expiry date, and we don't know whether the graph is going up or down in the coming years. So that uncertainty also adds up to what we're going through. Last year, people faced a lot of fear. There was tremendous amount of fear amongst people. Now the fear is plateaued to a great extent, and it's either frustration or a sense of helplessness or guilt or grief. But the fear has plateaued to a great extent. So when all these things come together, you go through this period of languishing where you can't do anything constructive. Now, most people, when I ask them what they do to take a break, the period where people were making all those coffees and posting paintings and artwork, and I don't see people doing that anymore. So
Yeah.
there was like, lockdown, hey, I know this is what I'm supposed to do. Now people are not able to engage themselves into something very constructive. And what they do for refreshment or to feel better is social media or Netflix or something of that sort, where you just distract yourself, push all your feelings under the rug, go to a different mind state and get out of it. So I tell people that it is difficult. There is no doubt about it. But if you're preparing for a horrible future, and suppose we have a good one, you wasted all this time thinking, first. Secondly, whatever activity I engage in to keep myself, to recreate or to feel myself rehabilitated, has to be something that I do without the gadget. It has to be productive, it has to be non competitive, and I have to enjoy the process more than the outcome. So if I'm exercising, if I'm painting, if I'm cooking, I enjoy the process more than the outcome. So I have to find that activity for myself. And if a few days I feel like not doing anything, that's absolutely fine. So these are few things that one can do about languishing. And most importantly, I most people are like, half the day is gone. Now what am I going to do? I'll start tomorrow. Or if two, three activities are not as per schedule, most people give up. Today's day is gone. So tell yourself whenever you realize that you wasted half your day or your entire day, or even if you're 1 hour before bedtime, always think what I'm going to do with the rest of the hours. So I have 3 hours left, I have 4 hours left. What will I do with the hours in this day that I have left? Is the question you ask yourself.
That's very helpful. I I hope people are taking notes in terms of things that we can do, because I wish I was taking notes. Yeah, I think we are all going through this languishing feeling, because
Yeah.
there are so many days when, you know, like you rightly put, it's what's the use of all this? And sometimes, you know, so my way of coping is to bury my head into work. But sometimes
Okay.
I feel, am I not focusing enough on other stuff? So there's also guilt. So yeah, it is
Okay.
a bit confusing there. Um, Actually, this is a this is a tough question to ask. So when you lose someone, how do you deal with the guilt that you did not do enough for them when they were alive, or did not spend enough time with them, or did not talk to them enough, or also the thought that what could I have done differently, because there could be people around you telling you, oh, you should have done that, you should have done that, or even thoughts like be with them in the final moment, or some sense of closure. So how does one cope with these
Okay.
thoughts?
Yeah. So I think that this is the word closure that you used is extremely important for all of us. That I want to know I did enough. I don't want to be projecting blame. I don't want to carry that anger. And when we're not able to deal with these thoughts or these thoughts remains unanswered, it leads to complicated bereavement or complicated grief. So what I mean when I say these things is that a lot of times we have guilt for that matter is a very normal emotion. We deal with it over the years in very different ways. So in the sense, we believe that there are six basic emotions that we have. So there's happiness, sadness, guilt, anger, embarrassment, jealousy, all normal emotions, and we go through all of them all the time. But guilt is given a very special place in our lives. So when a kid feels guilty, you reward them. Oh, you're a good kid, you feel guilty. We feel nice about feeling guilty because we tell ourselves it means I care, it means I'm responsible. And then you start reinforcing the guilt over time, that okay, it's a good thing to feel guilty. But guilt doesn't come with responsibilities, it comes with shame to a great extent. That I'm ashamed that I wasn't there for my parents. I'm ashamed that I'm having a good life here and others aren't. So when you go through this phase, guilt becomes a negative emotion. Whenever you have a negative emotion, your brain does two things. Either it will project blame on something else, oh, that doctor, this country, this should have been different, or I try to find reasons for myself. Oh, I couldn't go for whatever reason. So I'm not taking responsibility because I'm trying to either avoid it or resist that negative emotion, and I go through it over and over again. We have to look at guilt very differently. Guilt means a sense of responsibility, and a sense of responsibility can only be taken for things that are present today and things that are going to happen in the future. We can only learn from the past. But very often we get stuck because I want to change the past. That I should have done that. I could have done that. And I'm ashamed I haven't done it. And I keep getting stuck in this vicious cycle. So whenever this happens, you get yourself back to the now. Take responsibility about what I learned, how it's going to change the way I look at life today, and what I can do in the future. So can I make one extra phone call to someone I know? Or can I share what I'm feeling right now? Because over the years, we talk about incidents, people, stories. We don't recognize and express our emotions at all. So this is a core lesson in these times, that we learn to understand what I'm going through, label that emotion, and express it the way it is. So this is the time to learn to express your emotions. And if you're feeling guilty, so be it. Guilt is an emotion. I'm going through it right now, but it should create a sense of responsibility and not shame.
Well, thank you for clarifying that guilt probably comes from shame, and how we teach ourselves that guilt is a good feeling, that if I feel guilty, I'm
Hmm.
good.
Hmm.
Also, the point that you made about recognizing emotions, I think that is something where a lot of us find it
Yeah.
very hard to even identify what we are feeling and then to express it. So, what are some of the things we can do for better mental health, not just for ourselves, but our loved ones? What can we do to improve mental health
Okay.
in such times?
Okay. So I'll tell you a few incidents that will help us understand this better. Uh, a few days back, I had a very severe leg pain for whatever reason. Nothing organic, just simple leg pain, and I kept cribbing about it all day. And then a friend of mine called and I spoke for an hour effortlessly. Okay, and at the end of it, my husband was like, "You had leg pain since morning." So the pain was still there, but I didn't suffer for that 1 hour. Pain and suffering is very different. Pain is the physical sensation. Suffering is the thoughts I attach to it. Why is this happening to me? When will it get better? The medicines are not kicking in. What if it's something else? What if it's something bigger that I missed out? And these thoughts that go on and on in my head create a sense of suffering. Pain, I can't help. Suffering is a choice. So I can choose whether I want to suffer because of it or not. The other thing is most people are hooked on news because it's the only new thing happening around us. My mornings are the same, my dinner is the same, people around me are the same, work is the same. News is the only thing that is changing. And that is creating a lot of problems in our lives. Most of the people I've seen of anxiety disorder, the trigger has been a WhatsApp video, or it has been some random forward, or certain visuals on the TV. So basic, absolute basic things I would say that you must not consume news first thing in the morning and last thing in the night. It should be a midday activity. Don't watch video formats of news. Read it once a day. That's enough. If you don't know what happened in the next 2 hours, nothing is going to change in the world. You can read about it tomorrow. Then sleep. A lot of people, a lot of parents are complaining that kids are sleeping at 3 a.m., getting up at 11 p.m. There's no sense of timing at all. So I think what time you go to sleep and what time you get up, we can excuse our kids to some extent in the current times, as long as they're fulfilling what they have to. But 1 hour before bedtime, keep all gadgets off. Have a good night's sleep and have at least 30 minutes of walking around in the house, if not anything. Simple, simple things. A lot of kids are losing interest in studies. Good, those who are really good at academics don't feel the need to get into academics and studies. I think that we can have smaller goals for ourselves. All the things that we thought we'll achieve by 2021, 80% of it is beyond our control. So keep asking yourself what is within my control and do just that. So news is something that you should limit yourself. Sleep is extremely important, is the anchor of good mental health that one must do. And suffering is a choice. So if I'm suffering, I'm choosing to do it. That is something we should keep in mind in today's times.
Thank you. I think these are very doable, and we'll definitely try working on these. Um, there is one thing, as you were talking about children, uh, how do we, deal with when there are, news of deaths or tragedies? Should we protect our children and not tell them? And same with parents, with elders, because
Yeah.
we feel that, they are, not in good health, or it will disturb them. So how do we, deal with news? Should we share with our children and with our elders, or withhold information? What would be better for them?
So I think with children, no, it's a very situational question. There cannot be an age that I can tell you that after this age you can talk to your kids about death or about even for that matter. It's very difficult to talk about sex to your children. Most parents try to avoid the topic as much as possible, flip the channel, etc. So you don't have to deal with it. I think that as far as kids are concerned, you have to supply as much as the demand. In the sense, if your kids ask you a question, answer it. Answer it to the best possible knowledge. You children initially have this concept of permanence. Like, so my mom goes to work, but she comes back. My father is gone outside for 2 days, but he'll come back after the business trip. So they don't have this concept of gone away forever. It takes some time for them to accept it. But it can begin with showing them about plants, showing them about animals and how life cycle works. But don't give them the information because you don't know when they're going to be ready. So if they ask you a question, do answer about death of a loved one. If they were very close to that person, I think the blow has to be cushioned a little bit, but don't keep information from them. because they'll feel more betrayed and more lost and more confused because you'll have to conjure up so many lies to cover it up. So don't lie to your kid. Tell them what they need to know. As far as elders are concerned, if they're going through dementia or they're going through some mental health crisis already, it's not very wise to share the details with them because it might further deteriorate. Or you can do it if they're under therapy or with a psychiatrist already. So under guidance, yes. Otherwise, if they're mentally fit, I think they need to know. They need to know. For all you know, they might adapt to the information better than you and me.
Yeah. Yeah. Somewhere we start, believing that we have to manage. They're probably more resilient than we are.
Yes.
I'm mindful of the time, so I will ask you one last question, and then we'll open it up for the audience. So, you know, a lot of times we are going through, emotional turmoil, and we don't know when is the right time to actually seek professional help. So,
Yeah.
what is a way for us to figure out when to actually look for professional help?
Okay. So the thing is that right now, like I said, a lot of people are not going through a disorder or a crisis situation, but you may see them very upset, crying, having sleepless nights. So the lines are very blurry to understand that, okay, this is something that will get better and this is something that I need to seek professional help. As far as grief is concerned or loss is concerned, usually we give it about a month's time at least. So in that month's time, it's possible to have dreams about the person. It's absolutely normal to have even hallucinations to an extent about the deceased. Also to have sleepless nights or to relive moments, to feel anxious. It's possible, all of it. But we believe that every week should be better than the previous. You should get into your daily routine gradually. You can't expect to forget it entirely. It's not going to happen. They're always going to be a part of your life, but it's not going to impair your daily activities. So, simply put, if a person beyond 1 month of a loss has sleepless nights, when I talk about sleepless nights, I mean non restorative sleep. If they get up in the morning not feeling fresh, if there is a sense of constant irritability, anger, or a change in personality which wasn't there earlier, if there is a sense of hopelessness, what's the point? I mean, a lot of people say that I won't do anything, but if this COVID takes me, it's not such a bad thing. So that having these escaping thoughts already, these are not suicidal ideas, these are escaping thoughts. If you're having these thoughts already, and if you feel that you cannot focus, concentrate on anything on your daily chores that you're expected to do for over 15 days, then you must seek professional help. Also, if you have even one panic attack, you must seek help
Hmm.
now.
Okay.
So you don't have to wait 15 days if you have a panic attack. If your brain says that so many people are gone and people are moving on, so if I'm not there, it won't make such a big difference. And if you start making a plan in your head about how you're going to die, you must seek help immediately. So suicidal ideas, panic, immediate help. All other things, at least 15 days. And if someone is grieving, 1 month after the grieving process.
Sure. Thank you. I think you have shared so many useful, tips with us. I'm just going to look at the questions that are there on the chat.
Yeah.
Okay. Um, and I will request, if I call out your name, just please unmute and ask your questions directly.
Okay.
Okay. Kishani, would you like to unmute and ask, please?
Actually, I wanted to ask a question on behalf of my mother-in-law, but I think she has logged off due to technical issues. Maybe you could just briefly give me some advice, and I can have a chat with her. Basically, in terms of losing a child, um,
Hmm.
I mean, I lost my husband a few months ago, and my mother-in-law, for her, it's her second son that she lost. and
Okay.
she's struggling. I mean, we read up and we try different mechanisms, and we find a way to cope. But she's having a really tough time. Is there any advice that I could give her? Any way I could help her?
uh, I feel that religion can be a very good anchor for a lot of people. Someone probably who is your mother-in-law, so she's probably a little of the senior generation. So their belief and their hope that religion really helps you, through those concepts of, they're in a better place kind of thing. You can try through religious methods if that works. Other option is if she's really not able to cope and it's affecting her daily life, you look out for the red flags. If there are definite red flags, she'll probably need a grief counselor or maybe a psychiatrist, most probably a grief counselor to go through the grieving process more comfortably if you feel that all the things that you're doing at home are not helping her enough.
Thank you,
So,
doctor.
religion and grief counseling, maybe one to one individual grief counseling will help her.
Thank you, doctor.
Yeah, yeah.
Thank you. Manish, would you like to ask a question?
Yes, thank you, Dr. Nahid.
Yes,
I
hi.
want to ask, hello. I want to
Yeah.
first thank you for your insights, wonderful insights. And I want to ask you about people who are very extroverted. Of course, I'm not very extroverted myself, but I have people around me who have become very dysfunctional
Hmm.
because they need the energy of people around them to do any activity.
True,
Um,
true.
so, is there any advice for them on how to carry on with things which are very important in life, like exercise, your daily work, and how should
Yeah,
they maintain their rhythm and their motivation because they are now confined to a solitary environment?
yeah. So I think that this lack of social exposure in adults and even in children is very prominent these days. So children don't get their friends, they don't get to go out, they don't get to play around. That's where they derive their recreation and their energy from. And similarly, this is happening with adults as well, who derived all their energy and recreation from going out. So I feel that there is obviously no quick fix for it. It doesn't look like things are going to get better anytime soon. But the only thing one can do in such times is find, first of all, suffering comes if we don't accept it. So you suffer because you tell yourself again and again that I can't go out, I can't meet my friends, I can't socialize. If you accept that this is a part of my life that is going to be, the suffering reduces and the acceptance comes in. When the acceptance comes in, you will find solutions yourself. You will find activities and things that you never thought you would be engaged in and find ways to engage yourself in that. So, like I said, that you have to have one activity in your life which is not helping you earn money, which is not competitive, which is productive, and you enjoy the process. So that not necessarily has to be talking to somebody because that is again dependent on someone else. So an
Yeah,
activity for myself, independent of anyone else, that I can do to feel that energy coming back.
wonderful. Thank you.
So
Thank you so
yeah,
much.
thank you, thank you.
Thank you. Uh, is there anyone else who would like to ask directly? I don't see it in the chat, but if you would like to ask, please unmute and feel free to ask.
I had another question which I had posted in chat.
Okay, sure,
Would
go
like to
ahead.
ask.
Yeah.
Yeah,
Yeah.
doctor, this question relates to building resilience and ensuring that you stay positive. So, of course,
Yeah.
I have heard a lot of very useful tips from you today. Are there
Hmm.
anything else that you can advise us on how we can rebuild our resilience and
Okay.
positivity in today's
I
environment,
I
and
think
not
that
slip into that zone of negativity and
yeah,
helplessness and shame and guilt? So I want
yeah.
to be like a preventive more than a curative.
Okay. So
Yeah.
I think that most people were very averse to the idea of meditation. And even if you do it for a few days, are not able to be consistent. So they're like, I did it, but once people say nothing happened, I did it for 10 minutes, nothing happened. I don't know what the expectation is, but nothing happened. Or people just lose interest and they're not able to be consistent. So I feel that now There are a lot of informal meditation practices available. So you can eat mindfully, you can have a walk mindfully. So when you're having a typical meal, you're most probably watching the news, talking to 10 people, and after the first bite, you notice only after all the food is over that I'm done. So it's a very mindless activity, and that is something you're going to do for the rest of your life. Eat food.
Yeah.
So make that one meal a day a mindful activity where you are using all five of your senses and you are present entirely while eating your meal. And that will be a form of meditation. So you
Sure.
can have small activities planned,
Mm.
maybe a walk that I'm going to actually notice how my body moves, how the shoes feel, how the air feels, how the clothes feel on my body, and be there entirely. Maybe for 10 minutes and do that throughout the day. So that gives you the effective recreation and the breaks that you need from time to time to get yourself into the present.
Sure.
So that is
Thank you.
something that can be done. Yeah.
Thank you.
I think Gayatri has a question. Gayatri, please go ahead.
Hello.
I
Hi,
guess.
Sunal.
Yeah.
Thank you for giving me the opportunity to ask this question. Dr.
I
Dave,
guess.
it's a pleasure listening to you. I mean, all the practical tips you've given, procrastination of worry, guilt is a ailment, suffering is a choice. I mean, so doable and such practical tips. So I have a different question.
Mm.
I'm in the situation where I'm providing support to people who've lost
Okay.
someone.
Okay.
So like I lost my uncle and I lost an uncle-in-law. So I'm providing support to my parents. I'm providing to my in-law. And frankly, now I'm getting a bit overwhelmed myself providing the support. So what should one do, in this kind of a situation?
Okay. I think first of all, you should pat yourself on the back every day. Good work. Good work.
No,
And
I mean, I haven't been able to do any professional work. Sonali knows. But yeah, okay, thank you. I'll pat myself.
You pat yourself. That's not the only thing. I think that it can be very overwhelming. But I think from time to time, you can tap in your own emotions and think from time to time that am I getting irritated? Am I getting pressed? Remember, you are no good to anyone else if you don't take care of yourself.
Yeah.
So if you want a break, if you feel I want to watch this movie, I want to sleep today, do it for yourself. And
Okay.
then tell yourself I'm doing this so that I can help them better.
Sure. Thank you. Thank you, doctor.
Okay. Anyone else would like to ask a question? You can unmute and go ahead and ask. I know it's difficult. So if you don't want to turn on your camera, that's also fine. If you just want to ask, you can go ahead.
Okay. May I ask another question?
Yeah,
Yeah,
sure.
yes, please, Gayatri.
Yeah, Dr. Dave. So, a close friend lost her brother just last week. And she called up and she spoke to me for 1 hour, 20 minutes. And she says, Gayatri, I have no one to grieve with. And she says, I've lost my sibling and I can't speak about this to my parents. And because I have to be strong for them, and I can't speak to my sister-in-law. She's grieving in her own way. So I listened to her. It was a long conversation. So my question is, Dr. Dave, should I make regular phone calls and check how she's doing, or should I switch off, or what will help her in this kind of a situation?
I think that you can let her know from time to time, either by calling or even texting, that I'm there if you need to talk. So don't let it become a dependency that she has to talk to you whenever she's feeling upset. So maybe some days she can deal with it herself, and some days she feels like talking to you. Even when she does, she knows you're there for her. So you need not call her every time to make sure, although your intentions are in place, but that might just prolong the process sometimes. So if she needs to talk, you're always there. Check up on her, maybe text her from time to time and make it known to her that you're there. But calling each day is not required.
Thank you.
Yeah.
Actually, this is something we are seeing in many WhatsApp groups also, when somebody passes away and people are messaging rest in peace, or you know, may the person basically
Yeah.
we just send a text message, and
Yeah.
there was a conversation in one of the groups that this is not enough, and if something happens to me, please call my family. So that's where somewhere I think we are all trying to figure out what's the right way to
Yeah. Yeah.
so our condolences, and also how can we really be there without forcing ourselves in terms of pushing them to talk when they're not ready to talk. So what's the sort of right balance? That is
Right.
something we can
Family insist that just leave us alone for some time, like let us be for some time, because what happens is there are too many inquiry calls on what happened, how did it happen, you already know, did you reach the hospital late, those kind of things. It's very tedious to answer the same question or repeat or go through the trauma all over again. So I feel that we should not keep the focus on the details of how what happened. That is really irrelevant. And focus more on how are you feeling now? What can I do for you now? These two questions will really help the other person connect. So now it depends on how close you are to the. If they're an immediate family member, you probably need to check up on them for a few days at least. But don't go into the details of what happened and how it happened. They are very irrelevant questions. And it's not helping them grieve by repeating it over and over again. So only two relevant questions. How are you feeling now? What can I do for you? That these are the only two things you ask. And if you're close enough, you make a phone call or a personal message. The RIP on the groups is really meaningless. Most of the time it's copy pasted, so it doesn't really have any value. So if you're close to someone, call them up, have one conversation, and then you can text and check up on them whenever they wish to talk. You're available.
Thank you. I think that gives some clarity in terms of how to deal with it. There's a question: how do we help children cope with guilt when they lose a close family member?
Yeah, so children have this very important thing that they do, that is they introject whatever happens. So if their parents are fighting, it's because of me. So if something goes wrong, it's because I've been bad. You tend to think the world revolves around you. Okay, whatever bad and good is happened is because I've not been a good boy or I've not done what I'm supposed to do. So over there, the guilt can magnify, and then that can affect their self-esteem in the long run. So to clarify that it's no one's fault that this has happened, and you are feeling certain things. So even a 3-year-old, I think everyone must have experienced. 3 and 4-year-olds have anger outbursts and temper tantrums. So even they feel the whole range of emotions that we do as an adult, but they don't know what they're feeling. So, and as a kid, it's even more difficult to express it. Yeah, I'm feeling guilty, or I'm angry, or I'm frustrated. Most of the times, even sadness and depression, they express as aggression. So aggression is the way to express every emotion. But I think it's necessary as a parent to talk to your child. Don't presume you know what the child is going through, because I am the mother or I am the parent. I know what my child is going through. Ask them and teach them the vocabulary to express what they feel. And that begins with you doing it yourself. That I'm tired, but I'm not upset. I am angry, but I am not tired. So they should understand the difference between what is happening. Suppose you don't let them watch TV for some time and they get upset or angry about it. So you ask them, what are you feeling because I didn't let you watch TV? Get them into the vocabulary of expressing, so you know what your child is going through. So even when there is guilt, first of all, there is no reason for a child to feel guilty, but it's very natural for them to feel so. So you have to clear the air that no one is responsible for what has happened. God is not punishing you because by taking this person away from you. This is just a natural phenomenon which has happened in our lives, and we'll deal with it ourselves. And as they go, they also are going to go through different stages. You teach them to express.
Yeah, thank you. Any other questions? Okay, there's a question. Do pessimists find it more difficult to cope with grief?
Okay, so I think that optimist and pessimist are very, very vague terms. Like as mental health professionals, we believe that there is a reason a person is a pessimist or an optimist. That's because it's not because of the life instances or the experiences they've had, but it's because of how they perceive those instances. So what is the script that goes on in your head that nothing good is going to happen to me? It's me, na? It had to happen. Or or something good will happen. I'm very confident. I'm very hopeful. What is the script that goes on in your head decides whether you are an optimist or a pessimist. And I think that being even the most optimistic people, even grief counselors themselves have experienced grief and complicated grief and guilt in today's times. So it doesn't matter who you are as a person. And I've seen crazy optimist on pessimist after an incident or after an event. So I think that if you feel you're having too many negative thoughts, don't just push it aside thinking, oh, I'm a pessimist or that person is always a pessimist. If it's happening too much, you must seek help for it. You must talk to a professional if it's happening too often.
Thank
So
you.
a lot of patients even come and say that, I have counseled so many people. People ask me what to do. I can't believe I'm talking to you today. So
Yeah.
it's okay. It's okay. It's absolutely fine. It can
Yeah.
happen to any of us.
Yeah. No, thank you for sharing that. I think, even a doctor needs a doctor sometimes. I think
Yes, definitely.
we need to recognize that. There is a question which is slightly on a different topic, but since we have you here, we would like to ask you how widespread is the imposter syndrome in women and men, is a question from one of the participants.
Okay, so imposter syndrome is something that is conjured up on the internet. So we don't believe in this syndrome as a part of psychiatric diagnosis or evaluation. And if you ask me how common it is, I feel that we all put up a mask, no, in some way or the other, on how I'm supposed to sound, how I'm supposed to talk. Because even when I'm talking, I'm thinking about what people are thinking about me, how they are perceiving me, how I want to be perceived. Because we all know over the years, first impressions are extremely important. And I need it all works on need. So I need something from you. So I want you to look at me in a certain way. So we're doing it all the time. All of us are doing it. Sometimes it crosses the boundaries, and sometimes it becomes too much of a deception where you're lying to yourself also at times on who you are and develop an alternate reality or a fantasy and start living it. So yeah, I mean, statistically, it is found to be more common in women, but I feel that it could just be because it's diagnosed more in women, or I don't know. At some level, I think we're all doing it. We're all doing it for different rationalizations. We tell ourselves this is something I need. This is something I have to do. I'm doing it to protect someone else. You give yourself different rationalization, but at some level, everyone's wearing a mask.
Thank you. Thank you for sharing that. If there are, since we are almost just 1 minute away, so Kim or Gayatri, would you like to say something as we wrap up? Yeah.
Hi. Thank you, Dr. Nahid.
Hi.
It's been amazing listening to you. I think you brought up so many valid points out here. And I was just going through my notes that I made while you were talking. I think since our whole topic was about coping with guilt and grief, I think one of the most important points you made is that how as children guilt is rewarded and guilt comes with shames. And as long as guilt comes with a sense of responsibility and what we can do about it, then guilt is a good emotion to have. So guilt in itself is not a negative emotion. But where do we take that guilt is what we need to focus on. So that's really been a huge eye-opener. It's changed my way of thinking. And I really thank you for that. The other points, I'd just like to get back. Some people joined in a little bit in the middle. So I just want to take up on some of the highlights on what you spoke and just reinforce those. One is the sense of helplessness. I don't know anyone right now who is not feeling the sense of helplessness, because we are stuck in different countries. Even if we are in the same city, there's nothing we can do. I've seen friends who are going crazy, helping others, trying to find a hospital bed, trying to find oxygen. And despite doing all that, we're doing as much as we can. We are talking to people, trying to do something, but there's still this huge sense of helplessness because we are not able to do what we would have been doing if we were not in lockdown and isolation and unable to travel. And when you said it's about feeling stuck, that totally struck a chord. It's because I am feeling that I want to do this, but I'm not able to do this. And I think the strategies that you gave us to deal with it, about checking what is in our control and doing what we can, but not focusing on what I can't do, because given the scenario, there's a lot we can't do right now. And hopefully at some level, we will soon be able to accept the fact that we can't do as much as we would want to do, which was again a brilliant, mind-blown kind of experience when you spoke about it. I think Sonali brought up languishing, and languishing is also something I've been hearing a lot about with the people that I've been talking about. Last year, as you said, everyone was making Dalgona coffee. They were putting things up on the internet. I'm doing this, I'm doing that. And now if you talk to anyone, what did you do? I watched this on Netflix. I did this, I did that. But it's not with a sense of accomplishment. It's not with a sense of achievement, because there is no end in sight. Last year, there was a lot more hopefulness when talking to people. I'm talking to older people, younger people. There was a lot of hope that, yeah, okay, fine, we'll deal with this right now, and then things will get back to normal. But somehow there seems to be no end date on the horizon, which is why I'm sensing a lot of languishing in the people that I'm talking to. Even if there are achievable goals, people who are studying, students who are in their degree years, people who are looking for a job because they're about to finish their graduation, and they're like, we really don't know what's going to happen. Companies are not hiring. This is not happening. Why am I studying? Why am I bothered about answering my exams? There's a lot of this, like, it's okay, I don't need to do it. And that all comes somewhere, as you're saying, from the languishing, because of the vulnerability that we are feeling right now. And the fear has plateaued, as you said, but the helplessness, guilt, and grief has become more. And we're just distracting ourselves rather than getting in touch with our feelings. And you said it's very important to teach people, even as children, to teach them to recognize their feelings and speak about it. And that is what can help us go forward. So, and the last point that you made that I'd like to stress on is the fact that suffering comes only because we cannot accept what is happening to us. It's a choice whether we suffer about something. And I like the fact that you gave timelines, that if someone has a panic attack or someone is having suicidal thoughts, then it's time to go to a therapist immediately. But if you have gone through a loss, I have lost quite a few family members and friends. And yeah, it took me a couple of weeks. I was also offline, stopped work, because it takes time to process. And sometimes I was not able to connect with the rest of the world because I needed that time to be on my own and reconcile my feelings. And the fact that suffering is a choice, that we choose to suffer. The pain is there. And you also said that 1 month is a good time to give yourself. Sometimes we have this messaging from the media that, okay, fine, someone's passed on, you grieved 1-2 days, 1 week. No, now get back to work, get back to normal. That doesn't always happen. And the fact that you said 1 month is a reasonable time does give a lot of hope, because we're not able to grieve the way we would have before something like COVID happened. We would have had, the family would have been together. You have the 13th day ceremony, we have the month's mind. So there is a 1 month process or a 3-week process or a 2-week process that we normally have as a family. And now this is happening at an individual level. So the fact that you said that it's good to have that timeline in mind, that 1 month is an okay time to give yourself. And then if you're still feeling so pressurized, so that you're going through too much suffering, that is a good time to look at a professional, which is a nice thought to hold on to, and a good thing to be able to tell others when you're talking to them, that give yourself that time.
Yeah.
And the most important thing was that when someone else is going through this, just tell them that I'm there. Let them cry, let them grieve. Don't try to make them feel happy. Don't try to, which is what you said at the start, don't try to tell them someone else has it worse. Just be there, say, I am there. Let it come from them. Don't try to push them into situations. So I think there's so much to think about. I've got pages of notes out here. And for all the people who are out here, we will be putting small snippets of these things on YouTube so that you can, the main points that we have discussed, and also this whole interview, this whole session will be on YouTube soon. We can continue this conversation on GalaxShe, on the platform for the women who are out here. We'd love you to join our platform. We are discussing a lot of things out there too about guilt and grief and a lot of other situations that we are going on to. We have students who are saying, how do I deal with this scenario when I'm stuck at home? Parents are not able to understand what we are doing. We are not able. So we are discussing so much more on the platform. We'd love to have all of you also on the platform with us, the women only, sorry. But we'd love to have you on our platform. And I'd like to thank Dr. Nahid for all the insight, all the tips. It's been very, very helpful. Thank you again to Sonali for anchoring this. Thank you to Coach Khadija for getting us in touch with Dr. Nahid. And I'll just hand it over to Sonali to say a last few words.
Thank you, Dr. Nahid. I think speaking with you, listening to your thoughts has been really helpful, and I'm sure it will help a lot of other people as well as we share it further. And thank you so much for taking out time. You have this brilliant way of simplifying and just coming to the basics of what needs to happen. And thank you so much for your time, all wisdom. Thank you.
Thank you, Sonali. Thank you, GalaxShe, for having me. And I had a brilliant time. This is what I love doing. So,
yeah.
Go ahead. So, and also I have, I think, a few mental health guidelines. I think I had forwarded it to you a while ago. So if people want to understand just simply how to go about the pandemic, taking care of your mental health, you can forward it to them.
Sure. And with your permission, if we can share your contacts also in the video so that people can reach out to you for any support.
Definitely.
Thank you so much. Thanks a lot.
Okay, take care.
Thank you everyone for joining us. Yeah, thank you.